Hi, Dr. Jeffrey Mark here. About 2 months ago, I presented certain supplements to boost your immune system in response to this global infectious disease crisis. Recently, over the past month, more studies and case reports have supported a few of the key supplements I presented, and I would like to share this information with you. I've recently recommended liposomal glutathione, N-acetylcysteine, vitamin D, zinc, and quercetin to several people that have been short of breath and suspected to have COVID-19 or SARS-CoV-2. The reason I made these recommendations is because oxidative stress on the cell and the mitochondria play a key role in whether COVID-19 progresses to complications and or a poor outcome. Glutathione is a key antioxidant. N-acetylcysteine, or NAC, vitamin D, and zinc also play a role in decreasing complications and poor outcomes through other mechanisms. First, let me explain what is oxidative stress. Oxidative stress can be a byproduct of energy production or an accumulation from environmental toxins that lead to damage, or the ability of the cell or mitochondria to properly self-regulate. That's just among other things that could be going wrong. So reactive oxygen species, or ROS, are generated from many chemical reactions in the cell and mitochondria. Superoxide is an oxygen molecule with an extra electron and is a reactive oxidative species and the key cause of oxidative stress. Oxidative stress was mentioned last week in the lengthy discussion with the mitochondrial deep dive that we had gone through. The reason superoxide is increased in a patient with COVID-19 is because of the following diagram. Angiotensin II that is produced in the cell normally can increase superoxide, but is balanced by the fact that it usually gets converted to angiotensin 1,7 by an enzyme called angiotensin converting enzyme 2, or ACE2. This enzyme is downregulated or inhibited by SARS-CoV-2 so that there is a higher amount of angiotensin 2 since this is not being converted. To make matters worse, SARS-CoV-2 or COVID-19 also promotes the production and activity of polymorphonuclear neutrophils, which also lead to an increase in superoxide. The other downside is that angiotensin 1,7 normally causes the reduction of superoxide, and if it's not being produced, that also won't happen. We discussed extracellular superoxide dismutase elsewhere in the blog Exercise Decreases Risk of Viral Respiratory Complications, and we also talked about dismutase in the deep dive about the mitochondria last week. The hydrogen peroxide can be dangerous as it can break down to form a hydroxylated molecule or a free radical that can then damage the body. But fortunately, the body has two enzyme systems, one called catalase and also peroxyreducins, both of which require iron. They convert the hydrogen peroxide to water. And glutathione peroxidase also converts hydrogen peroxide to water by oxidizing or adding an oxygen molecule to glutathione. Glutathione is made from glutamate, glycine, and cysteine. Cysteine is the rate-limiting step, or the hardest of the three ingredients to come by. N-acetylcysteine is a good source for the cysteine molecule, which will recharge the stores of glutathione. It is also a precursor to make glutathione directly. There has been a recent study now that examined what if you just gave glutathione directly instead of giving N-acetylcysteine as a precursor for the body to make glutathione. The paper is entitled Efficacy of Glutathione Therapy in Relieving Dyspnea Associated with COVID-19 Pneumonia. A report of 2 cases by Richard I. Horowitz, Phyllis R. Friedman, and James Buresi. This was published on April 21st, 2020. In the paper, it was cited infections with COVID-19 potentially can result in severe outcomes and death from cytokine storm syndrome, resulting in a novel coronavirus pneumonia with severe dyspnea, acute respiratory distress syndrome, fulminant myocarditis, and multi-organ dysfunction with or without disseminated intravascular coagulation. They went on in the paper and wrote, quote, "We evaluated the effects of using high-dose oral and/or IV glutathione in the treatment of 2 patients with dyspnea secondary to COVID-19 pneumonia. A trial of 2 grams of PO or IV glutathione was used in both patients and improved their dyspnea within 1 hour of use. Repeated use of both 2,000 milligrams of PO and IV glutathione was effective in further relieving respiratory symptoms. They concluded, quote, oral and IV glutathione precursors such as N-acetylcysteine and alpha-lipoic acid may represent a novel approach for blocking NF-kappa beta and addressing the cytokine storm syndrome and respiratory distress in patients with COVID-19 pneumonia," end quote. N-acetylcysteine in other studies have shown a potent thrombolytic effect on arterial thrombi. Arterial thrombi have been thought to be the reason for hypoxemia with pulmonary artery thrombosis. This is a clotting mechanism in terms of thrombi are what we call multiple small clots. So von Willebrand factor causes the formation of disulfide bridges to form a mesh-like structure that causes clotting to occur with a lot of platelets in it. N-acetylcysteine, or NAC, and reduced glutathione will break the disulfide bonds and lyse or break up the clot. Recent autopsy reports have shown that patients that died from COVID-19 had very, very small clots in the bronchioles of the lungs. So if you think of the lung as a shape of a tree with oxygen and carbon dioxide coursing through instead of tree sap and water, spreading out its branches and down to the level of the twigs, you can see that in the bronchioles they're even smaller than 1/3 the width of a human hair. This is what you can compare the bronchioles. They're very small in proportion to the trunks or the large airways. This is the analogy of even smaller than a twig to the main branches of a tree. If you can imagine now these tiny clots that are plugging up the different twigs and branches of the lung, then you can get the idea of how these patients could have a lack of oxygen. In another case report, a Russian researcher, Alexey Polanikov, at Kursk State Medical University published a paper entitled "Endogenous Deficiency of Glutathione as the Most Likely Cause of Serious Manifestations and Death in Patients with Novel Coronavirus Infection," or the COVID-19. A hypothesis based on literature data and own observations. The abstract is as follows. He writes, "Based on an exhaustive literature analysis and own observations, I proposed a hypothesis that glutathione deficiency is exactly the most plausible explanation for serious manifestations and death in COVID-19 infected patients. The major risk factors established for severe COVID-19 infection and relative glutathione deficiency found in COVID-19 infected patients with moderate to severe illnesses have converged to me to 2 very important conclusions. 1, oxidative stress contributes to hyperinflammation of the lung, leading to adverse disease outcomes such as acute respiratory distress syndrome, multi-organ failure, and death. And 2, poor antioxidant defense due to endogenous glutathione deficiency as a result of decreased biosynthesis and/or increased depletion of glutathione is the most probable cause of increased oxidative damage of the lung, regardless of which the factors aging, chronic disease comorbidity, smoking, or some others were responsibility for this deficit. The hypothesis provides novel insight into the etiology and mechanisms responsible for serious manifestations of COVID-19 infection and justifies promising opportunities and the prevention of illness through glutathione recovering with N-acetylcysteine and reduced glutathione. So from the discussion of the recent articles we just went through and going back to our discussion from 2 months ago about immune boosting supplements, we can see that there is now more evidence to support the use of glutathione and N-acetylcysteine. I believe that these key supplements, which help boost the immune system, are among the best supplements we have at the current time to stay healthy in this global crisis. Because of the questions and needs of several people, I went more in depth about these supplements and the supportive studies currently available. We have therefore postponed our discussion of the brain and mild cognitive decline this week. I look forward to next week's video and blog and hope to meet you at that time. For more information on AFH pharmaceutical grade glutathione, vitamin D and K, zinc active, natural allergy support with quercetin, food intolerances, Mitomax, or other immune boosting tips, please see the blogs on www.allfunctionalhealth.com/blog. If you have comments, questions, or want to learn more about how functional medicine can help with improving your brain and immune function, call our office or email info@jeffreymarkmd.com. Stay healthy and take care. So if you'd like to take advantage of the time you're sheltered in at home to do the GI Reset program, please call our office to schedule a telephone or telemedicine video chat consultation. We now offer online functional medicine assessment, HIPAA-compliant video or phone telehealth visits, and in-home functional lab kits that you can mail back directly to the laboratories. We can work together to address your health challenges in the comfort and safety of your home during this shelter in place and beyond.